Hi, my name is David Emerson. I'm a long-term cancer survivor, cancer coach, and director of People Beating Cancer. Welcome to the vlog post, Stomach Cancer, Need to Know. Stomach cancer, sometimes referred to as gastrointestinal cancer, it's a difficult diagnosis. I certainly understand that. But when I say need to know, the blog post linked below is my effort at researching and providing the basics. Basics being the type of cancer, staging, stage 1 as an example is very different than stage 3 or 4. In my experience, it behooves you to understand the type of cancer you have, the stage, what your symptoms may mean, both conventional standard of care therapies, as well as evidence-based, but non-conventional therapies. By that I mean diet, moderate exercise, what's commonly referred to as prehabilitation, in effect, preparing yourself, preparing your mind and body for treatment, has been shown to help patients live better, longer, potentially heal faster if you undergo surgery, chemotherapy. I've even linked possible therapies. I'm not an oncologist. I'm not saying these are the therapies that you should do. I'm just saying these are the therapies that the FDA says you might undergo. Certainly talking to your oncologist is important. He or she can make recommendations. I certainly encourage that. But you are the patient. It's your job to figure out what your goals are, how aggressively you want to treat your cancer, what therapies you want to undergo, what risks you want to take on. All therapies, in my experience, have risks and benefits. Understanding those is extremely helpful in your decision making. It'll help you ask better questions of your oncology team. Talking to your caregivers your conversation will help, will be furthered by the basics that I'm referring to that are in the blog post linked below. Certainly, if you have any questions or comments, scroll down, ask me a question. That's what I'm here for. In the meantime, thank you for your time and attention. Hang in there, and good luck.